afternoon. We're so pleased to have Isis Gerschultz here today from the Matt Adams Foundation. This program is part of the library's What the Health series. Isis is the harm reduction coordinator at the Matt Adams Foundation. This foundation is a 501c3 nonprofit which funds the distribution of life-saving Narcan kits. Naloxone. No, I can't say that. I'm so sorry. It's an opioid overdose reversal kit, as well as other harm reduction materials, while also working to break down stigma, encourage hope, healing, and second chances. She's here today to tell us about harm reduction, share opioid and fentanyl facts, and how to recognize the signs of an overdose. She'll also demonstrate how to use the Narcan kits. So, Isis, thank you so much for being here. We appreciate it.
Well, hi everyone. Thank you so much for being here today. We're a 501c3 nonprofit, and we provide harm reduction resources to people that might not have access to them otherwise. We provide all of our resources for free. So when you guys think of harm reduction, what do you typically think of?
Hey, Mike. Thank you.
There you go. All right, what do you guys typically think of when you think of harm reduction?
Clean needles, stickers.
Needles.
Right. Yeah, that's most people, their brain takes them to supplies like that, but harm reduction is for everybody. It's as simple as wearing sunscreen, wearing a seatbelt, using a condom. Harm reduction definitely is not just for drug users, but the majority of what we provide to people are naloxone kits, fentanyl test strips. We do provide clean syringes if they ask, and condoms as well. So this is what our kits look like. So they're very discreet, they're easy to carry around. I recommend that you carry it around in your purse or backpack if you have one, whichever you carry. You're also able to keep it in your car, but if it gets below freezing, it can decrease the effectiveness, and then of course if it gets too hot. But I will say that even if you have a naloxone kit that's expired, or maybe it got too cold or too hot, it's still better to have it and to use it if you need to, instead of to not have it at all. But if you do have some naloxone that has expired, or you just feel like you need to be refreshed on naloxone, then we'll gladly trade the expired in for a new one. So in our naloxone kits, we have 2 syringes, we have 2 alcohol prep pads, and then 2 vials of naloxone, so each vial is 1 dose. And then we also have a little instructional insert just to, on one side there's the signs of an overdose and how to recognize them, and on the other side there are instructions just to give you a step-by-step rundown of what to do in the event that somebody is overdosing. But on the front of our kits, they have a QR code, and that will take you directly to our website. And it will take you to a video of just an instructional video. So, in the moment, that could be easier to just turn your volume up, set your phone to the side, and, than having to read this little insert. But we do put those in there anyways. So if you think that somebody's overdosing, the first thing you're going to want to do is call 911. So some signs that someone is overdosing: they could be blue or purple or gray, their skin tint, their lips can be the same, and their fingertips. So the first sign that you'll probably see is they'll be unresponsive. So that's a really good indication that somebody is overdosing. And even if they've just had too much to drink, it's just still a good idea to check on them and never leave them alone, because you never know. It could be a combination of things. And it could just be alcohol, but it's still good to check on them. So some other signs could be their heartbeat. It could be erratic or slow or stopped completely. The same goes for their breathing. And then you could hear choking sounds, snoring like, any gurgling. They could have chills. So there are definitely a variety of signs. Not all those signs are overdose, but if there are a combination of those signs, it's more than likely an overdose. So yeah, the first thing you're going to want to do is call 911, and you can put your phone on speaker and set it to the side and just let them know that you're going to go ahead and administer naloxone. And then they might walk you through it, or, you know, if you're confident or if you already know how to do it, then you're still just going to want to have them there. So the first thing you're going to want to do is you're going to want to swab wherever you're injecting the naloxone. So you'll want to inject into a muscle. So, you know, upper thigh, shoulder area. Just try not to inject into a vein. So whatever is easily accessible to you. And then after that, you're going to want to pop the orange cap off of this. And then you'll take the syringe, pull in the full dose of naloxone. So like I said, this is just one dose. We include 2 of everything in our kits because sometimes 1 dose of naloxone isn't enough to revive someone. I think the most I've ever heard of somebody having to use to be revived was 7 doses. I mean, yeah. Yeah, and Jordan, who will be joining us soon, he actually has a story about that, where he was the one who had to revive somebody, and the paramedics ended up having to shoot them up with 7 doses of naloxone. So it's definitely not one size fits all.
I've had to administer it twice, and both times I used 2 doses. And then honestly, one person had barely put a dent in it. They began to regain some color in their lips, but I still had to do CPR. So it's really good to follow up with other recovery techniques. If they're not regaining consciousness, don't fully rely on the drug, because with the fentanyl, it's really strong compared to the normal opioids, like a prescription opioid that we would commonly see before.
Yeah, and it is usually done in combination with other drugs. And honestly, most of the time it's accidental that somebody is ingesting fentanyl. And yeah, so after you've administered that first dose, like Stephanie said, you'll want to do some other techniques like CPR, and you'll want to wait a couple minutes and then administer the second dose. But by then, hopefully emergency services should be there and they should take it from there. So a common misconception about naloxone is that after you've administered it and somebody's pulled out of it, that they're fine and they're good to go. And that's not true. So it really can just buy you time, especially depending on how potent the fentanyl in their system is. So you'll definitely want to seek further help. You know, if you're at a party with someone and they overdose and you give them naloxone and they're fine, they can start to begin to go through that overdose again.
Yeah, they say about 30 minutes.
Yeah.
You have about 30 minutes to get them to the hospital, because the opioid will attach back on the receptors and it's still in the bloodstream.
The fentanyl lasts longer than the naloxone.
Yeah, definitely. Yeah. And then, you know, sometimes it can build up in your system. Like, let's say somebody has a powder of some sort. We'll use cocaine, for example, and they're doing small bits of it throughout the night. So it might not, like the first time they do it, it might not cause them to overdose, but it can build up in their system throughout the night. So yes, it can definitely last in the system for a while, a lot longer than naloxone. That was well put. Yeah. So you'll definitely just seek medical attention for them. And then are any of you guys familiar with the Good Samaritan laws? Yeah, well, so for those of you that aren't familiar, and we have them on our website as well, but the Good Samaritan laws will provide legal immunity for anyone that is administering naloxone. So if you're in a group setting or even at home, but if you're with somebody that's overdosing, even if you're using drugs as well or you're guilty of some sort, you will not be penalized. It's fully legal for you to administer naloxone, even if you administer it and it turns out that somebody was just too high on another drug or just too drunk and shouldn't have been administered, then you will be protected. So that does vary state to state, but in Arkansas we have a couple of different laws that provide legal immunity. So, and that is something that I like to educate people on. That's one of the number one things that I like to educate them on is don't run, call 911. You will not be penalized by law for it.
And you'll also be immune to like getting in trouble for the drugs like, as long as you're not like a giant drug bin,
Yeah.
you're pretty much gonna be fine, in terms of getting in trouble if you have substances, or say you have weed pipes out or something simple like that. Like, the police are not gonna be concerned with that, and if they do send the police, they do it they say they do it to protect the EMTs in case they're walking into a dangerous situation, and just making sure that they're safe. They're not there to search the home, and you can't be charged with anything within the home.
Yeah. And that is something that might potentially prohibit somebody from getting help for a friend. I mean, I've seen it many times. I've heard many stories of that happening. So yeah, we have the Good Samaritan laws in place, and it's really important to know that. And yeah, that's not on the front of our kits, but the QR code will pull that up. So are you guys familiar with fentanyl test strips? All right. So I did not bring them to hand out today because they are considered a felony in the state of Arkansas. It's a felony paraphernalia charge, which is absurd in my opinion. Yeah. But this is what they look like, and they have a QR code as well to scan and go to our website, and just basic instructions. And then I opened this one up to show you guys what they look like. So they're just small, they're really easy to use, and they're very accurate. So if you use one and it comes back that your substance is positive for fentanyl, don't let anybody try to tell you that it's false or inaccurate and that they're right and then the drugs are fine. So yeah, these are very accurate. If there is,
People will do that as like
Yeah.
a knee-jerk reaction. I don't know why. I've
Yeah.
seen so many people test stuff positive and they're no, like rereading it, and it's just like, no,
Yeah.
this test is very accurate, very simple.
yeah, they're like, no, the tests don't work, they're lying.
False positives
Yeah.
will only happen with some amphetamines and like MDMA at high levels. So you just test with a lesser amount of that substance than you would if you're testing at opiate.
Yeah, and it really doesn't take much of what you're testing to detect if there's fentanyl. So, you can just get a small, like if you have a powder, just get a small amount, you'll mix it with just a small amount of water. If you have a pill, you'll just crush a little bit of it up and do the same thing. So it really doesn't take much of your substance away from you. They're very easy to use. Again, they're easy to carry. But, I just like to give people the heads up that it is considered a felony charge. But, have you guys heard of anybody being penalized for fentanyl test strips?
I don't think so, but I was living in Colorado where we, like, the state pays us to hand them out.
Yeah.
So I haven't lived here in a while, so I haven't heard
Yeah.
of that. But they are trying to pass laws actively here, so definitely keep an eye out on that.
Yeah.
The sheriff's office says they won't use it as a standalone charge.
Yeah.
Right,
That's
good.
Yeah.
Pretty much like if you get caught like dealing and you got like, trafficking or whatever, I think they will charge you with it then just to add extra charge.
Correct.
Yeah.
Yeah. But it is at the officer's discretion, so you could come in contact with an officer that, it's left a bad taste in his mouth, the fentanyl thing in general, and so he could penalize you. But otherwise, yes, these are easy to carry, and if you would like some, we have a hotline number that you're able to text, and we have volunteers throughout the area, and they'll just meet with you discreetly in either a public place or drop off at your home. And I do have some stickers back there as well if you guys would like, with our hotline number on them. And if you do take home naloxone and you use it, please let us know, because we do get funding for that. And we'd be happy to give you more and more fentanyl test strips. And we don't ask any questions. We just, we're judgment free, and we'll meet up with you or mail them out if that's what you're more comfortable with. Or if you have friends who are out of state and don't have access to these resources, we'll happily mail them out some as well for free. So we mail out everywhere. Just last week, I mailed out to Alaska and Hawaii in the same week. I mailed out about 30 packages, so it's definitely been picking up, which is good to see. Yeah. Do you guys have any questions on how to use the naloxone or how to use the fentanyl test strips?
Why is it illegal to have the test strips?
The only thing I could think of is that it encourages the use of drugs.
Yeah.
A lot of
But-
places or people, old way of thinking is that harm reduction is enabling. So if we
Yeah.
give people clean syringes, ways to test their drugs, or safe ways to use their drugs, or access to health care and treat them like humans when they're on drugs, then we're creating like a safe space for people to become drug addicts. But there's so many studies now that actually completely conflict that idea, and so it's just waiting for the laws and the
Right,
whole
'cause it seems
system
like
to
it'd
catch
be
up.
safer if you were testing it to make sure that there wasn't fentanyl. Because our goal is to keep people alive, right?
Right, yeah.
And if we look at prohibition of drugs, it's clear that making things illegal is not working for America's addiction problem. We have like a mass substance abuse disorder issue right now.
Yeah.
And the only way to really treat it is with like science-backed things that work, such as harm reduction. But it's harder to get the law to agree. We're like, okay, everyone catch up.
Yeah.
And slowly states are catching up, and slowly federal laws are catching up. Like they just passed that Narcan can be available over the counter
Yeah.
federally, which is
really cool.
awesome. So it's just a matter of waiting for the red tape to move along too.
Yeah. Yeah, and people, you know, I'm sure being back in the area, you know how it is. It's
I was
interesting.
working at syringe access programs in Denver where we literally are giving out 75, 80 needles or syringes at a time to people, and we have different ones. We have ones for steroids, we have ones for trans people that need needles for hormones, like anything you could think of, we had a different size needle and syringe for. And we were able to actually be honest with people about how to safely shoot up, minimizing people clogging the hospitals with like abscess and things like that, because that's a huge problem there. It's just trying to create a clean, because the people are going to do it, so we want to minimize the stress on like the healthcare system as well by showing them, at least if you're going to do it properly, so we can keep you alive long enough to maybe give you a chance at recovery.
That's,
Because if they're dead, they can't recover.
Yeah.
that's reducing the harm.
Yeah, so that's the main goal, is to kind of open up a bridge of communication between addicts and people who love people.
Yeah. Yeah, my favorite stories I hear of even getting back to us, people that have actually been able to recover. Yeah, dead people can't recover, and you know, dirty syringes perpetuate the spread of disease, and just all around, you know, having access to clean syringes is nothing but good. But yeah, we all know
And it
being in
actually saves
Arkansas.
taxpayers money too, so even if
Yeah.
you're just a money person, which yeah, I am, and so I've looked it up, but it's cheaper to give these people
Yeah.
clean syringes than it is to treat their HIV, their hepatitis, because that falls on us as our Medicaid, because those people usually don't have health care.
Medical reasons too, and they can't get the
Yeah.
needles and they can't take their prescription.
Yeah, even we had some diabetics even that would come and get syringes from us, because they just don't have the financial ability to purchase those things, and diabetic medication's so expensive.
Yeah, if their insulin wasn't expensive enough.
Yeah.
Yeah, definitely. Yeah.
So harm reduction's for everyone, it's not just for
Yeah.
addicts, you know.
Yeah, and you know, we've heard stories of people that were not even drug users that have overdosed. Like girls out drinking on Dixon Street and they got roofied, and the roofies have fentanyl in them. So these are, you know, just college age girls that have probably never even done drugs, or, you know, maybe have a couple times but are not perpetual drug users, and now they're overdosing. So it's dangerous, and could be someone's first time doing a drug at a party, or their friend offers them something, or they're having a bad day and their friend's like, hey, here's a Xanax or a Valium, you know, take the stress off, and they could overdose and die. So it's definitely, harm reduction's not just for drug users. You know, anything you could possibly think of drug-wise, there's a good chance that there's going to be fentanyl in there. You know, pills, coke, molly, meth, ketamine.
In Colorado, we were seeing 80% of street
Mhm.
drugs have fentanyl in it now. So that means if you're at
Yeah.
a concert and 10 people have a bag of Molly or Coke or whatever, 8 of those 10 bags are going to be tainted with fentanyl.
Yeah.
Which I don't know if the numbers are here are as high. I haven't looked at studies for here recently, but in
Yeah,
Denver, it's
right.
There's not much
Out of
street drugs
control.
here, really. Yeah,
Yeah.
Colorado's definitely as bad as it gets.
yeah.
Yeah. Well, and that's how xylazine is now.
Yeah, it's
So, have you guys heard of xylazine at all? Yeah. So it's technically like a veterinary drug. It's a tranquilizer, and it causes trank. Yeah, trank dope. Yeah, that's just what we've heard it called. But that's like the new fentanyl. It's affecting people pretty badly. But unlike fentanyl, it causes flesh-eating wounds. It's really bad, and naloxone cannot treat a xylazine overdose. So that is something we're working on getting test strips, but they're very hard to access. The minimum order for us was $75,000. It covered a lot, but that is just the minimum order to get your foot in the door. So we are working on getting those, and I am going to add a little instructional insert to our kits, just explaining what to do in the event of a xylazine overdose. In Philadelphia, the numbers were about 90% of street drugs had xylazine in them. So obviously in this area, we haven't been as heavily affected, but it's trickling down, unfortunately. So yeah, just try to stay informed, keep in touch with us, and if you have any questions, we'd be happy to answer. I don't really think it's that prevalent in the area, but I feel like it will be, unfortunately. Yeah.
So, one thing you didn't mention that I think it's important to touch on, you talked about, in related to the Good Samaritan laws, using naloxone on someone who is not having an opiate overdose doesn't have any negative effects. So if somebody is passed out on Xanax or passed out on alcohol, and you give them a naloxone shot thinking that they're overdosing on opiates, it doesn't hurt them. It just has no effect because there's nothing for it to work on. But it doesn't cause any damage.
And you won't be penalized for it either.
Right. Yeah. Oh, and you can do it through the pants. Like if you're going for a leg muscle or in the glutes.
Yeah.
Yeah.
Yeah, whatever's just the most easily accessible to you. As long as it's not a vein, just a muscle.
The muffin top, like the upper lower back, where they do like steroid shots. If you've ever had one of those, it's a really good place to get a good chunk of fat.
Good to know.
The tramp stamp area?
Yes.
Yeah.
I'm a tramp, I'm not.
Are you stamped?
You have a fish tramp follow.
I have the tribal tattoo, thank you very much.
That's funny. Oh, classy. It's much classier than a fish tattoo.
Yeah, no, that's it.
Yeah. Yeah.
Thank y'all for what you do. I just
Yeah.
want to say that I was excited. I just happened to be at the library and I heard the intercom because I used to work on the U of A campus and I'm a mental health practitioner. And this is so important because even my father-in-law at one point, like, it happened to him while he was actually in the hospital, but he had an accidental overdose.
Oh, wow.
And they had to administer Narcan to him in the hospital, so we've always
Yeah.
had it on hand and taught my mother-in-law how to use it. So yeah, I just appreciate so much what y'all do. And
Yeah,
I saw
thank
y'all had
you.
a presence on campus too. And
Yeah.
so I don't work on campus anymore. I'm in private practice, but I just appreciate it.
Yeah, well, thank you. I'm glad that we were finally able to have a presence on campus.
Yeah.
Stephanie and our founder, Heather, they used to have to sneak onto campus just to even put flyers up with their hotline number.
Sneak into bar restrooms and campuses and hang flyers everywhere. Like, I literally almost got in a fight with a bartender sideways because he's like, "Screw harm reduction." I was like, "Screw
Oh,
you!"
wow.
I was like, "No."
Yes.
It was very vigilante at the time. A little thrill. I liked it.
Yeah, we actually this past, like a few weeks ago, we actually were able to participate in a safe spring break event. Well, a couple of events. So we actually did like a training on campus, and we had a booth set up at this event, and we were able to distribute like 200 test strips and kits, and it was really cool to see the students' responses, and they were definitely happy to have access to our resources, and I was happy to be there and to give them access to it, and so
My friend
it's
that's
definitely
a
time.
professor for Halloween weekend. She had like a bag of candy and naloxone that she put in like a bag that you couldn't see into and told students to grab either one on the way out, and that way no one would see them grab it.
Yeah.
And she said when she left class that day, all the naloxone was gone.
That's really
So it's
cool.
pretty cool. People are really responding well.
Is that Whitney?
No, her name's Dr. Miller.
Do y'all table at community events or have like a presence at other places off campus?
Yeah, definitely. So usually how that works is people will email us or message us through social medias and ask if we'd like to participate and do tabling, and we almost always say yes, unless it's just too far for us to travel or we don't have the volunteer presence or I'm unable to do it. But yes, we absolutely do. We have a couple of upcoming events. We believe that the next event we have will be on Saturday the 22nd. I'm pretty sure that's Earth Day. Or at least it's an Earth Day tabling event, but it's at the AM PM bar here in Fayetteville. So yeah, that'll be our next event. But yeah, we absolutely do. We're scheduling events for the summer and, you know, spring and summer. Yeah, we have a couple music festivals on the schedule, which is great.
Oh, that's a perfect
Yeah.
place, yeah.
Yeah, but
There's
it's
so
just-
much going on there.
Yeah, and a lot of drugs, definitely, to go hand in hand. But yeah, it's been a little bit difficult just trying to get people to accept us and allow us to come in and have a booth set up. There's a venue in Eureka Springs called The Farm. No, Jordan is familiar with The Farm. But we're still trying to get them on board, and they're a pretty good big music venue, and they do a couple of festivals every year. But other than that,
I know a lot of people that work with them. I can harass them too.
I was
Yeah.
gonna say,
Back in
I
town.
do
Yeah.
too,
Yeah.
and I spend a lot of time there, so.
Yeah.
Cause I've thought about asking them if I could ever do, mental health first aid if it's needed, so
that'd be a great idea.
Yeah, so, but hopefully y'all could, cause that would be a
Yeah.
perfect place.
Yeah, I think so too. I've been going to their festivals for years,
Yeah.
and they're wonderful. But I was very disappointed in them when they wouldn't allow us to come. So we're just trying to work on that, and yeah. Well, thank you guys so much for being here today.
Thank you.
And yes, please help yourself to naloxone and any stickers back there. We have stickers with our hotline number. Anything you'd like, help yourself. Yeah.
So I was